Hi everyone. We're just going to start the live, waiting for Dr. Bhavna to join in, and we will begin in just right after that. So join us in, just setting it up. Hi, Dr. Shreshtadhar. How are you? Thank you for joining. I see Bhavna. Just give me one moment. Hi.
Hi.
So good to see you.
Are you able to hear me?
Yes,
Same
very clear.
here.
Just give me one moment, Dr. Bhavna. I'll just, just setting it up here and we will 1 minute. All right. We are ready. So, Dr. Bhavna, thank you so much for joining us. Can you hear me?
Hello?
You're able to hear me?
Yeah, Divya. Yeah. I think there's a little lag.
Okay, just let me, uh, yeah. I think my network is okay.
Mm-hmm. Okay.
Fine.
Cool. Yeah. I think this is good.
All
I'm
right.
just trying to figure out the thing. This is my first live on Facebook, though.
Woohoo! Yay!
Yes.
So, just to give
Right.
everyone a brief background, Dr. Bhavna uh, has been, I've attended, I think, two of her sessions on Pilates, and they were absolutely mind blowing. And I had never tried these exercises. And she's an amazing instructor, by the way.
Thank
So,
you.
and that got me thinking. As to okay, why not do a live and understand more about the work that she has been involved in, and talking about the core strength in women, right? This is something we are unaware of mostly, because there's lack of awareness, and people are so busy that whatever exercises they can do, they manage it, and they don't even know the impact of it. But just so and they focus more on I need to lose weight, weight, and they are not at all talking about building strength in their body. So great. So not to wait further, let's start off. You can please share a little bit about yourself and the work that you do, and thank you so much again for joining us. Yeah.
Thank you, Divya, for this opportunity. And it's a great job that you guys are doing, bringing about awareness to the society, more so to talk about health. Hello everyone. I am Dr. Bhavna. I'm basically a physical therapist. I'm practicing as a consultant in two centers. One is in Blue Bliss Hospital, Sheshadripuram, and the other is a women's clinic in Malleshwaram, which is called Indira Clinic. So, I am also a Pilates instructor. Uh, for the ones who do not know Pilates, I'll be coming down to that later. So, Pilates in brief is a workout which emphasizes on working on your core and bringing about body awareness and mindfulness. So, my experience is more so very good with women's health and also handling chronic pain. So, the pain
Okay.
which is there for more than 5 to 10 or 20 years, people have got better because one, they've got more awareness of their bodies. I think that is what is more important, and that is what is lacking to us because most of the time we look for temporary relief or something which is a quick fix. So making them understand to know their bodies and heal by themselves is what I emphasize. So that ways I would probably be proud to tell that I stand a little away from the group of other healthcare bodies in such a way that I make sure that you understand your body before you leave out of the place. So that way, Pilates,
Wonderful.
my own experience has been a great, like highlight or, I've started understanding my body better. So that way, Pilates has added more value in terms of physiotherapy and other ways of trying to manage people's pain. So this is it about me, and I've also been doing a lot of online thing, bringing about body awareness. I have my own page called thebodyandmind.com. So there are a lot of videos that I put, a lot of content information for the ones who are keen on listening.
So sorry, this just going to make this
Oh, that's okay. Absolutely
the
fine.
volume go down. Multiple
Oh,
devices. Yeah, yeah, please.
yeah. So
Yes.
this is it. So mainly my focus is on bringing about health India, like it's not just about workout, it's not just about pushing yourself, it's about understanding yourself better. And coming down for the ones
Yeah.
who want to get leaner and who want to become thin, the notion of uh, talking about, how to become leaner, I think it's more important for everybody to become stronger. And as a woman, I
Yeah.
come down to my clinic with most of them talking about, doctor, can you help me become lean, especially post pregnancy? They have bellies side, and I said, give it a break. You just delivered a baby, you've had it for 9 months. Don't go that hard on your bodies. And women have this tendency of going and pushing their bodies too much. So I think that emphasis is what I would like to, like discuss about. So coming to the topic, which I thought is at most
Yes.
important, is the core.
Yeah.
So, what do
Yes.
we understand with the word called core workout when we usually say it's a workout which is generally focused on the core muscles? So, to make it very clear, what exactly is the core muscle? Most of us are the ones who know. Most of them are in the notion that it is the abdominal muscle, six pack abs, and certain back muscles as such. But then there is more to it than. Are you with me?
Yep. Yep. Yeah.
Yeah. So talking about core again, is it's not just the abdominal muscles. There are many muscles in the front itself. There are like four muscles, and it's like a barrel. So let's talk about anything with a barrel. So you have all the sides, you have a lid on the top, and the base as well. So when we're talking about the core, the front is covered by your abdominal muscles, which is in the front. The back is covered by your back muscles, which is at the back. And then on top is your breathing. Okay, it's very important for anybody to do the core workout to emphasize on your breathing, which is on the top, the way you breathe. And the one which is on the lower part is your pelvic floor. So, pelvic floor is nothing but the
Mm-hmm.
place void in women. It's the place where you void urine, the place where you have your vagina, where the baby pops out, and the place where we pass stools. So, there are three openings. So, that is
Right.
also okay, that is also a muscle, and it is important to strengthen that muscle. So, as women, we fail to
Yeah.
understand that there is something underneath which we can control. So, when we think, okay, I know what to do on my abs, I know what to do on my back, maybe breathing to some extent, but there's still more scope to it, but we hardly realize what is pelvic floor. So pelvic
Okay.
floor is basically the base of your body where your uterus, your bladder, and your, the anus falls in place. So for most of the women post delivery, they have incontinence, they have sometimes they end up having tears or they might have a episiotomy, the cut for the baby to come out. And for the ones who do not undergo these things as well, that kind of drops down because your baby's weight is so big, it's 2 to 3 kgs, you will certainly have a drop. So during such instances, it's important for us to strengthen those muscles. So there's a
Mm-hmm.
very
Mm-hmm.
famous thing, and there's a lot of insight about Kegels exercise in your
Mm-hmm.
pelvic floor.
Yeah.
So
Mm-hmm.
very clearly, Kegel exercise does definitely talk about strengthening your pelvic floor muscle. But are you sure that your pelvic floor is tight and loose, tight and weak, or is it, like sensitive and weak? So that is
Mm-hmm.
why it is
Okay.
important to go to a physical therapist who's specialized in pelvic health, which I am. So
Okay.
you need to understand when a woman goes through trauma of birthing or even during your menopause, even before pregnancy, the pelvic floor as such for some people is irritated. So there are
Okay.
many people who say, I am doing my core workout, but I'm not seeing any results. I'm doing a lot of belly exercise. I'm not seeing any result. That's only because
Hmm.
you're focusing on only the front part. You're not
Hmm.
focusing on your breathing. You're not focusing on your
Yeah.
pelvic flow. So it's this is basically the core. So you have on top your breathing, in the front your abdomen, at the back you have your spine muscle, and the base you have your pelvic floor. To make it very clear, I'll just put a picture so that you can understand. I am just, so you get a better
Yeah.
idea. I'll just
Till the
put a
time
couple
you
of,
do that, for the
yes,
people who've just joined us, please feel free to leave your questions here so that doctor can take them and answer. And we have series of questions lined up for today's session. So yeah.
yeah. So if you see, this is the
Okay.
side portion of your body. The diaphragm
Mm-hmm.
that we all know for breathing is the one that makes the core of the muscle, which is on the top. And the front
Yeah.
that you see is the deepest muscle. It's not the six pack ab, it's the first layer of your muscle. So this is called as your
Right.
TA muscle, transverse abdominis, at the back, right behind the spine. For the women who talk, I have back pain, I'm not feeling good. So it could be that this muscle and this muscle are not in harmony. It's just like a common
Okay.
balance, right?
Okay.
And
Okay.
coming to the base, you have your pelvic floor. Can you see exactly? Beautiful
Yes.
muscle, just that we do not take care of it. We don't give it much love.
Hmm.
Okay, so this is basically about the core.
Sure.
And
So I have series of questions with me, Dr. Bhavna, and I thought, this would be a good is this is a good opportunity to ask you and understand more. So all our body types are not the same, right? So women have different kind of body types. So can you throw some light on the kind of body types that we women have?
yeah, so like the usual form of body types that we usually look in the internet, we have a gynoid type where the hips are larger. Some people have a broader shoulder. Maybe I would not want to talk about that. I would want to talk about the kind of muscle or fat which is surrounding your body. There's one type of body which is more muscular. Then there is a second type of body which lacks muscle, but there's more water retention in the body. So if you see women who are mostly overweight, there are two kinds of people who might be overweight. One could be fat and muscle with equal proportion. But for the one, the moment you can find out for yourself, when you try pressing
Mm-hmm.
your, you tend to, it kind of becomes like a cake. It's very soft. So that
Yeah.
kind of a body is more like water retention. So it's very important
Mm-hmm.
for a woman to understand, am I really fat or is it just water retention? So the mode of
Okay.
exercise is different for both bodies. For the ones who
Okay.
have actually more fat percentage, maybe need to get into aerobic activity, which is like all running, cycling, and all these stuff. But maybe for the ones who have more water retention, there is more
Hmm.
likely their muscle mass is less.
Okay.
So we all
Okay.
have certain percentages of muscle mass in each part of our body. So when the muscle mass is less, there's more chance of water retaining in your body. That could also be
Hmm.
one of the reasons. Alongside with other conditions like thyroid and PCOS, there'll be a lot of water retention. So maybe not in terms of form, but in terms of understanding the body, there are two body types in women. Maybe not lean. I'm not talking about lean. Lean also for the women who are thin will also have a fluffy body. So it's very important
Okay.
for you to understand, am I fat or is it just water retention? So
Okay.
the methodology of working out probably differs in both the things. And we have seen
All right.
results.
Okay, great.
Yeah.
And when it comes to the kind of muscles that we have in our body, for a woman and a man, I feel the muscle structure by itself is quite different. So, what is this difference? Why is it so different?
Right.
Yeah, hi. I think it just paused. Yeah,
Yeah, I think there's a lot.
yeah,
Okay.
we
So
can carry on.
for the men and women, no matter how much workout we do, physiologically, men are more bound to get bulky in the sense that
Okay.
men have this hormone called testosterone, and women do have that
Mm-hmm.
hormone, but in very minimal quantities. So the
Okay.
testosterone hormone in helps in facilitating the building up of their muscles. And as such, the physiology of the men body type is different. But one
Okay.
positive point of women is we are more endurant. Like just
Hmm.
like how women take in more pains and do not talk about it even for
Yeah.
long term, similar way, our muscles are endurant enough. So the hormones like estrogen and progesterone to some extent play an important role in facilitating the overall well-being of your body. So women should understand as to how much they need to push and how much they need not push. the
Okay.
the the notion is different for athletes because their training is different, their food or the diet is different. But for the layman or for the general population, there's a difference in the exercises between men and women, and you just can't go gaga over, like, I need to lose weight, let me go on the treadmill, let me go on the cycling. I think it's more important for you to get stronger first and then follow up with doing any aerobic activity, because let's all admit, you want to lose weight but your knees might be hurting, you're depressed that you're not losing weight. I would say go to a physical therapist, get strong, not just at your knees, but your core, because that's the one which is taking the weight of your upper body. So once you start getting stronger, you'll feel lighter, and I guarantee that you're walking, you can still run. So that is more important for people to understand. The difference is basically with the hormones that we are talking about. So men have a different physiology, but nevertheless, I think the like I told, the endurance and other things, the proprioception, we are more perceptive towards it. So the workout can be
Right.
planned accordingly.
Right. 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 And what are the kind of effects that general exercises, the normal exercises that we anyone does, right, for that matter, in women? What is the effect of it?
Yes. So I think this is a very common question. I'm sure most of us are familiar with it. However, when you're working out, your body blood circulation will enhance because you're trying to do a lot of movements.
Hmm.
Again, depending on what kind of activity you're doing. When you're doing the two kinds of workouts, basically it's aerobic activity and the other one is strength training. So I would say
Okay.
all of us should include both. Like, let's say for the one who's just running randomly, so the running is only going to help in blood circulation, will bring about a lot of well-being to your body, and your breathing and everything is emphasized. So overall well-being gets better, but the muscles need some strength training. And when I talk about strength training, of course, core is going to be the most important thing. We women have a lot of activities with hand lifting right from the cooker. I get a lot of complaints of patients coming right from the cooker picking up things and stuff like that. So your shoulder strength is very important, and including your lower limb strength. So when you're doing these strengths, your body will start getting stronger, your physically you'll start being stronger, and you'll be endurant. When I talk about endurance, the stamina that you start from the day beginning till the end, you will be with the same energy level or maybe a little lesser, but not completely drained out. Your mental well-being, it is proven that when you work out, your mental well-being will start getting better. And
Yeah.
since you're giving more love to the core workout, when you're doing your core workout, there is a lot of things that goes around, because the core is right, it's putting all your vital organs, it's complete. So all your vital organs like your intestines, your liver, your stomach, your bladder, and everything is starting to feel that workout because you're giving an impact. So this not only gives physical over well-being, but also more importance to the organs. Constipation can get better, liver issues can get better, bladder issues can get better. So that ways it has an overall holistic physical and mental well-being altogether. That's
Nice, 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 nice. So, I hear a lot about aerobic work, exercises, gymming, and strength training. I really want to understand what is the difference, because for me it has always been about losing weight. I'll be very honest, and I've never really put that much effort to build strength, and it has always been the weighing scale on my head all the time. So, what is the difference between an aerobic exercise and a strength training?
Yes. So, first thing, since you already a live example for talking about, weight is very good to look into the weighing scale. It's actually good. But at the same time, we should also understand when we are losing weight, is it just the fat or are we losing muscle as well? Muscles have a tendency to forget. Like, let's say, even for gym goers, they do a good workout for 1 week, and the next week, if they don't do, the muscles start getting flaccid. They tend to forget. So, for the in aerobic workout, it works on your cardiorespiratory system in the sense it increases your heart rate, it increases your respiratory rate. So, then what happens? Your overall body warmth increases. So,
Hmm.
this warmth indirectly helps in burning the fat.
Hmm.
Okay.
Hmm.
But however,
Hmm.
in the process, we are not really
Hmm.
sure because we're not
Hmm.
working on every muscle. We're just jogging, we're doing cycling. We're not doing much for
Hmm.
the upper limb touch or not
Right.
very much lower limb. So we are not really sure if there is muscle gain. So when you're working
Okay.
out, you're definitely losing weight, but what's happening with your muscle gain? So that is why when anybody is losing weight, it's important for us to also think about strength training. So when you're talking about strength training, you can also think like resistance training. You
Okay.
probably can add workout, body weight
Okay.
workouts. You can start adding minute small weights to start with your shoulder workout. And again, you need to be doing with assistance or with guidance if you have no background of workout. Okay,
Yeah.
so that way Pilates helps you in understanding your body better. Of course, Pilates is an action. It's not like the whole and soul, but to keep your
Hmm.
posture upright. If you see, most of them have a very curved back. If they try to do exercise, they will probably end up having more back pain because they're pushing
Okay.
their. Okay,
Okay.
so for them, the posture correction is very important. Maybe for the ones who go to the gym or other workouts, they end up having some injury is probably because they
Hmm.
haven't worked out on the posture. They're only focusing on weight loss. So
Hmm.
Pilates helps you in working out on your core to making your posture upright. So indirectly, whatever pre-existing back pain or chronic pains that your body had can automatically get all right. So I would say weight loss should not be at the cost of giving or getting into pain or getting into injury or following some diet and reverting back. You know,
Okay.
so no crash diets and stuff. It has to be a process, and I think that should be more mindful in manner. So aerobic is more burning, strength training is more like adding more strength to your body. Every muscle needs love, like I tell. So right from your hand, you're trying to use your dumbbells, your shoulders. In Pilates, we have something called as fitness circle. That's a beautiful thing to start with your workout and stuff like that. So that means yes.
Nice. Nice. So, what is the role of these hormones then? Like, in women, the estrogen and the progesterone, how do they kind of play their role? Does that also impact overall health and the ability to really, take your body through to this kind of transformation? How does that happen? What is the role?
Absolutely. Very nice question. I think this is the need of the hour question types. Right. So there are two hormones basically. We have a lot of hormones in our body. Again, even like testosterone, we have it in our body, but in very minute quantities. So
Right.
the major hormones that plays a role is estrogen and progesterone. Okay. So all these hormones start activating once the female attains puberty. That's when the actual action happens,
Okay.
and they see when the woman attains menopause to a greater extent.
Okay. Okay.
So estrogen plays an important role of your sexuality, as in
Mm-hmm.
the non-existence of the hairs, which is there. Like just like men, we don't get beards and other things. That is the estrogen is the hormone, and bringing about sexuality and talking about libido, the sexual desire is mainly driven by estrogen hormone. Okay, then coming to again estrogen brings about a lot of activity in the uterus. Likewise, uterus is our main core. in our body, feminine aspect. Okay.
Yeah.
And coming to progesterone works directly to the uterus. There's a lining to the uterus which is called as endometrium. So whenever the endometrium sheds off, that is your periods.
Right.
So for the ones who have issues with their periods, there could be some, dysfunction with the progesterone levels. Now, why estrogen and progesterone needs to be very important? Again, it's all dependent on your mind and your uterus. They need to be in sync. Okay. So when the uterus is not correctly placed on your pelvic
Hmm.
floor, okay, they might probably, even they're uncomfortable because they're not upright, isn't it? So when your pelvic floor or your core is not functional well, the connection is not that great. In the sense,
Okay.
there is some kind of blood circulation happening in your core as well. Okay. So
Okay.
whenever you're activating your core, it's just like pumping. You do this, your arm workout, there's blood
Hmm.
circulation happening. Every time you do
Hmm.
your core workout, there's blood circulation happening all through the
Okay.
core muscles and internally to
Okay.
the organs. So a small example for the one there are many actually. There is one lady who's come with PCOS issue, which is not getting periods regularly, the coarseness of voice, and
Which
there
is a
is
very common, it's become too common these days. Yeah.
yes, yeah,
Hmm.
it could be many factors again, lifestyle and environmental changes being the major factor. Plus, I have seen random crazy workouts, not emphasizing
Okay.
things like that.
Okay.
The
Okay.
general advice given by most of the doctors is lose weight. That's it.
Hmm. Yeah.
Okay. So I would say, I mean, for anybody, it's not about losing weight. Activate your core first. So we've started
Yeah.
with Pilates for a patient, and she's taken 10 sessions. And it's not just correcting her PCOS, but she started getting well-being, the overall well-being. The women with
Hmm.
PCOS have a psychological effect because, again, hormone plays a role.
Yeah.
Right. So then her core
Absolutely.
started activating, her PCOS got better, her constipation issues got better, which is very common with PCOS and PCOD. So that
Okay.
way, activating your core in regulating your hormones has an indirect link to each other.
Okay. Okay.
Yeah.
Got it. Got it. Awesome. Okay. Now we've spoke a lot about the core and the pelvic muscles and all that. What about the torso? Uh, I want to kind of understand more about torso and what is the functionality of a torso? How does it
Hmm.
work? If you
Yes,
can shed
yes.
some
I'm
light on
just
that.
going to show you an image. It's more important for, like
Sure.
I said, the core is just like a wrapping structure which houses
Yeah.
all the vital organs inside. So if you take a look at it, you're indirectly when you're working out on your core. So the torso is again right from the top and till the bottom. So if you see
Okay.
feminine, we have our breast, our mammary gland, and behind we have
Hmm.
our lungs. So like I was telling, the diaphragm is the breathing muscle. Okay. Right below that, you have your stomach. And take a look at it. Everything is housed in the small box.
Hmm.
Okay.
Hmm.
Including
Hmm.
your large intestine, your small intestine, your stomach. Take a look at the uterus. And then you have your bladder. So these are the vital organs which are there in the body. And why is it important? Is imagine you're compressing,
Hmm.
releasing. What
Hmm.
just like pumping, all these
Hmm.
organs will start knowing, okay, I have some work to do. You're giving some
Okay.
facilitation to the body. And likewise in Pilates, we emphasize on the breathing. So every time this comes down, your lungs start expanding. So it's a little complex in nature. Maybe this session could not cover that. But
Hmm.
in
Hmm.
general,
Hmm.
so these are the organs which can be addressed while you're doing your core workout. Your
Okay.
constipation, the woman health issues, including your sleep apnea, which is getting up suddenly in the night because of lack of breath, which is very common in male people. So that can be rectified as well. And to
Okay.
some extent, the sugar levels, which is very common, there is a good significant result with the diabetes people and also hypertension because we're doing a lot of things around. So that ways,
Right.
understanding also and the core workout has a lot of things going around.
So it's nice that you are so aware when you are doing the workout, right? You exactly know for which part of your body how you are activating the organs, and very mindful way of working out So
Yes,
I think that's something we all should adopt in our workout regimes.
exactly.
So I think we've spoken about core, we've spoken about torso, but I understand that, there's so much myth around the core, right? Doing just a plank and you feel that you're working out your core. Uh,
Yes.
why don't you shed some light on that?
Yes, right. So for most of us, when we start off with doing the plank, so the plank is absolutely like that. The figure
Yes.
itself tells. But what happens with most of us, we end up getting into a mountain pose for the ones who are doing.
Hmm.
When you take a
Hmm.
picture, so what's happening there is we all have a buttock muscle which is like switched off, most of us, which is called as your gluteus muscle. Okay,
Okay.
so we don't yeah. So, like, let's say when you're sitting like this, try squeezing your buttocks. You will feel like you're lifting
Okay.
off the chair. So, when you
Right.
squeeze your buttocks, you will feel like you're lifting off the chair. The similar way with plank, we fail to connect the buttocks. So, when we go on the plank, we are only thinking
Okay.
going position. But
Yeah.
that's one of the exercises for your core workout. And what happens are many people who come with shoulder aches with the plank.
Hmm.
Okay, so when you draw your belly button in, I'm sure nobody can see what I'm trying to do. I'll just cue you one way. You're trying to take a deep breath through your nose, your chest expands. When you're breathing out like that, draw your belly button into your spine as much as you can. You'll start feeling your lower abdominal muscles
Right,
and relax.
right.
So when you're doing a plank, your breathing plays an important role, and it's just not getting into a plank. It's about connections again. So your buttocks, your big butt, small butt, whatever butt, needs to get activated, and your belly button, the connection. This is one of the plank variations that we have, but there are many other exercises. I think more than me talking, if anybody could get into my page and check out the exercises or probably come to a
Yeah.
live class, well, there is one class happening tomorrow on Sunday, which is at 11 a.m. The thing is put out on my page, The Body and Mind. Maybe people can go through that, and we can again, the body
They
and
can
mind is not
experience. Yeah.
yes. So you can have a like
So
a
you
prior
can
experience
post all
to understand.
you can post all these details on the thread as well, Dr. Bhavna. Once we are done through the
Okay.
session today, yeah, in the
Right. Right.
comment
Okay.
section, you can just post the links, and I'm sure
Okay. Perfect.
all the people who are joining us can refer it easily.
Perfect. Perfect. I
Great.
think that should be great.
Um, I also understand that there are certain exercises which are overrated, right? Which may not be adding a
Yeah.
lot of value uh, to our strength or the muscles, but still we continue doing. Can you please share something on that?
Yeah, overrated exercise. I don't know what specific exercise, but then, like I told, always start with basics. We are coming now. This is the phase that we are vouching out for a lot of online activities. So,
Hmm.
online activities, and I end up treating all the injured patients with online activities. So, I would always say start with your basic principles. Likewise, activating your core, starting your basic body movement. If you're tight, and you're trying to do something which the body needs that movement, you'll
Hmm.
definitely end up getting an injury.
Right.
Seek help, professional help to start off with doing something. And rather, I'm sure there are a lot of people who are coming up with their workout. Do a little background check about that or get into a trial class and then probably look into it because I personally believe sync with your body and mind, maybe you're not doing the right form of exercise. And for me, it's
Right.
not just about the quantity, it's about the quality. It's not just about more repetitions, it's about if I'm doing it at one time as well, am I giving it the right amount of activation? So
Yeah.
all these overrated exercises, I think, to keep it very short, start slow and understand what is being activated. Like when I ask somebody to get into a plank, the first thing they say, I feel my shoulders really pressured and stuff like that. I feel a little bit of my abdomen. But what do you feel in the back? What do you feel in your quads, which is in the front? So there's a lot of activation which goes around. Once you activate, even if you do it for 30 seconds or 1 minute, it sure is a killer workout. And plank is overrated.
Okay.
One. There are other exercises in Pilates, which is called APREP, which activates your core. And the second one is
Uh-huh.
called your 100. that activates your core, and then there is double leg stretch and a very beautifully designed exercise, and it's more
Okay.
choreographed in a manner. It's like a flow. So most of the time people don't get to know that they finished 45 minutes or 1 hour.
So for me, the real revelation was just the neck exercise that you did. Okay. And and I had
Could be
never
that.
felt and I had never felt that muscle at all. Okay, just turning and bending, and the kind of stretch you get on the neck was like, oh my God. So
Right.
uh, I think, yeah, and that was a and I felt great after that, like So so after
Yeah,
your
another,
sessions, I've
sorry, add
really,
on. Another
yeah,
add on. Every time after you work out, maybe you could probably feel a little tired, but not completely exhausted. If you're completely exhausted all
yeah.
throughout the day, maybe that is not the right workout for you.
I also have a question. This just came to my mind. Okay, when you take a huge break from
Yeah.
your workout, just because you just could not get back to your routine, right?
Yeah.
And you're getting back, you have these subtle pain that you get after the workout through the day, and then next
Yes.
day you feel a little better. But
Yes.
there are times when you have persistent pain, maybe on knee, or say the ankle. How can we differentiate what kind of pain is it? Is it just getting used to kind of pain, or it's a pain that I should really reach out to somebody? How do you differentiate?
That is a beautiful question, let me tell. I mean, you all needed it. Okay. So
This
what
is this
happens
is
is
me asking you.
right. So what happens usually after workout, whenever somebody does like immediately after a very long time, the muscle tend to get into soreness, which is very common. So that is called
Yeah.
as DOM, very fancily called as DOMS, which is called as delayed
Okay.
onset muscle soreness. That could
Ah.
probably
Okay.
be there, maybe for some people, depending on their body types, could be there for maximum 2 days. But it
Okay.
is overall, or it could confine to the body part that you're working on.
Right.
But the other thing that you're talking about, the pain which you feel even after that, is
Yeah.
make you understand, is it only my muscle or is it my joint? Because most of the
Huh.
time when you're working out, if your knee internally is hurting, maybe you're not doing the right way. Maybe you're
Right.
loading the joint and the muscle pain, both are different. So it's very important for us
Right.
to understand, am I hurting my joint? That's an absolute no-no when you're doing your exercise. But if you're working out on your muscle, I think that would be a great job because you will feel that soreness and that's not going to be for long. And I love that soreness. Sorry.
I love that
That
soreness.
gives a
I
good
love
feeling.
that soreness. Yes.
Yeah.
It's
So
like,
that
oh
kind of
my
feeling,
God.
yes. So that kind of feeling is good. For the ones who don't feel that way, maybe you should start slow or you need to have a guidance. You need supervision.
Yeah, mostly it has always been a challenge. So I come from a sports background, and my dad was a coach, and we've always been exercising, right? From God knows when. But every time I got on to do squats and lunges, uh, every time was a challenge. So I think my kind of body, it's heavy, and then when I work out, definitely there's a lot of pressure on the knee, and exercises like a lunge, or the squat
What?
definitely puts a lot of pressure, and then I do experience that kind of pain.
Right. So let me phrase it as that is going to be your level 2 of exercise. I mean,
Hmm.
start
Once you
with your
have
mat
kind of,
exercises. Start with your mat exercises. Once you start activating those muscles well, so sometimes it's not
yeah,
about just strengthening, sometimes it's also about lengthening, as in flexibility.
yeah,
If you're
yeah,
not flexible and you're tight and you're making it more tight, you will for sure get into an injury. So that way,
yeah,
Pilates concentrates on beautifully lengthening the muscle and activating it. So if you see, my session starts with stretches first, warming up, and then activating and then cooling down. So immediately
right.
when you hop into doing some exercises, maybe you will end up injuring your joints. Again, a
Yeah.
very thing. If you feel pain in your joints, any joint, maybe you're doing it
Yeah,
the wrong. So that is more
yeah,
an emphasis.
yeah. Great point. So I have few more questions. I have few more
Right.
questions. When we look at the back or the abdominal muscles, right? How do we activate these muscles in sync, like the abdominal and the back? Most of the time, we tend to do exercises which are very exclusive to one part of the body, but how can
Hmm.
it be in sync? Yeah.
Like I said just a while ago, we did a simple breathing exercise. Okay, so our abdomen and the back is like a corset. It's covered in the front and the back. So whenever we are activating the belly muscle in the right manner, we are slowly activating the back. Again, let
Hmm.
us do the experiment. I think you are the only model right in front of me. Let's take a deep breath through our nose.
Yeah.
When you're breathing out, try drawing your belly button as long as you can. Breathe out through your mouth. And then keep breathing long until I ask you to stop. Once you start feeling the pressure in your lower abdomen, you'll also feel the pressure at the back very little if you're doing it the right way. If you're not, maybe we need to do that practice. This is the way of activating. So,
Muscles.
yes. So,
Yeah.
eventually, when you start doing this exercise, either when you're sitting or lying down, you